Good morning. My name is Ellen Piwoz, and I'm here to welcome you to the Bill and Melinda Gates Foundation Global Philanthropy Forum Breakfast. Very good to see all of you here so early in the morning. This morning's session is called Nutrition in the 1,000-Day Window of Opportunity, New Science, Urgency, and Opportunities for Impact. And every year the Foundation hosts a session at the Global Philanthropy Forum to highlight one of our important strategy areas. In the past we've talked about malaria, we've talked about infectious diseases and neglected tropical diseases, and this year we're speaking on the subject of nutrition. I would like to turn the moderation of this panel over to my colleague Dominic Schofield from Schofield. From the I even wrote it down. Old habits are hard to change. From the Global Alliance for Improved Nutrition, and he'll introduce the panel and where we're going from here. Thank you.
Thanks very much, Ellen. Good morning, everyone. Delighted to be here. Again, to thank the organizers as well as the Bill and Melinda Gates Foundation for hosting this breakfast. As our title suggests, this session will look at the 1,000 days that begins with conception through to a baby's second birthday as a really vital, a critical period for when a lot of damage gets done, permanent damage gets done because of malnutrition. But really also, irony is that this is where you can get the greatest impact for investment in malnutrition, in addressing malnutrition. Joining me on this panel are we sort of have an arrangement here where we have two roses between two thorns. We have Christopher Grassett. Christopher Grassett is stepping into the breach for Craig Cogut, who apologizes for not being here. Mr. Grassett is Vice President Business Affairs at Covalent Technologies. Until recently, he was the Chief Operating Officer at the Sprinkles Global Health Initiative, housed at the Hospital for Sick Children in Toronto, Canada. He also acts as Chief Strategic Advisor to the Asian Initiative for Nutrition Development and is consultant to UNICEF and to us at GAIN. His varied career in technology, life sciences, and business spans more than 35 years, with a special focus on the development of innovative, market-driven nutrition and family health implementation strategies. The rose to my side here is Ellen Piwoz. She's just introduced herself from the Bill and Melinda Gates Foundation. She's the interim deputy director and nutrition lead for the nutrition team in the family health division of the Global Health Program. Her work is focused predominantly on research and integrated strategies to improve nutrition in women and children. Dr. Piwoz is a member of the Nutrition, Maternal, Newborn, and Child Health, MNCH, and HIV Strategic Program teams. Cindy Huang is Senior Advisor to the Global Hunger and Food Security Initiative in the Office of the Secretary at the U.S. Department of State. She played a key role in developing the policies that guide Feed the Future, the U.S. initiative that aims to increase agricultural-led growth and improve nutrition outcomes. With colleagues at USAID, Dr. Huang leads U.S. engagement in 1,000 Days, a global effort to advocate for increased maternal and child nutrition, and support implementation of the Scaling Up Nutrition Roadmap, the SUN Roadmap. Before moving on to the first speakers, I thought perhaps I would frame the discussion a little bit. And I think that probably the best way to do that is through a couple of images. The first is this. There are globally now about 1 billion people that are hungry. There are 2 billion that are not getting the vitamins and minerals that they need. I think 2 years ago was the first time in recorded history, so really since the mid-1960s, that child deaths dipped under 10 million. And of that almost 10 million, unfortunately, deaths, 3.5 million are attributed to malnutrition. This map really just shows you where the problem is, where the concentration of these deaths are. And it really drives home the point that there is a geographic dimension to this, one that really helps us to focus our resources and our minds towards solutions in Africa and South Asia. But for those children that survive, they will continue, of course, to be living in conditions where malnutrition is a part of their lives, in many cases normal. And this is a typical growth chart that we would find in any growth monitoring center that a parent would have for their child. I was with the World Health Organization a year or so ago in northern Ghana, in the Tolone district, and there must have been a stack of about 120 of these women lining up, as you see in the pictures here, being weighed with and without their child, the child's length being measured as well. The reason I'm showing this is that the key indicator for malnutrition that the global community uses is stunting, is stature, height for age. And the economists have shown us that there's a correlation between height for age and particularly stunting, which means lower than the normal curve, with losses in mental development and productivity, and ultimately in the well-being of communities and GDP. So this proxy for malnutrition is a key indicator for us and really where global goals are defined. But what is it? And I think that this helps to show best or illustrate best what we're talking about. In Tolone district, this particular growth monitoring center was really excellent. It was a state-of-the-art facility with the really excellent counseling, and mothers knew that it was important that their own nutritional status was well cared for, that they exclusively breastfed for the first 6 months, that they continued to breastfeed until 2 years, and introduced at 6 months an adequately nutritious complementary food. And I think that what this image shows is that even with that knowledge, as these mothers would go to kiosks or to shops or whatever, they would not find the product that they would need to feed their children. They didn't have access to the foods that all the counseling suggested that they offered to their child. And so even with all of the best of knowledge and best intentions, we start to see at 6 months, I don't have a pointer, but you can sort of, if you look at the graph from the left-hand side, you'll see numbers at the bottom, 1, 2, 3, 4, 5, 6. At 6 months, you see the child start to dip below the curve. And this growth faltering, this kind of Charlie Brown up and down, really carries on through to about 2 years of age, when once the child's stomach is big enough, they can consume more food. But they will stabilize their growth below the curve, and that's stunting. That's what we're talking about. And that really is permanent, and it also reflects what's going on in the mind. The collection of speakers that we have here will help us to understand the dimensions of this problem, understand what the science is telling us, and Ellen will begin to speak to us about that, understand what solutions there are, and there are solutions to this challenge, and particularly what the U.S. government sees as a major opportunity for addressing this, and to understand also what mechanisms, both public and market-driven mechanisms, are available to us to, again, address this challenge. So without further ado, I'd like to pass on to Ellen Piwoz, who will speak about the science, the evidence behind this approach.
Thank you, Dom. I'm actually going to speak a little bit about the evidence and a little bit about why the Gates Foundation has chosen to invest in what we consider a foundational or fundamental area for both global health and global development. And yesterday's plenary session started off with a presentation on sustainable agriculture, and one of the audience questions was, why? Why would you invest in agriculture? And if I were up there to answer that question, I would say that the foundation has chosen to invest in agriculture, improving agriculture, because as a means for reducing poverty, agricultural development is a double win. It's the main form for increasing both incomes of the poor as well as their health and nutrition. It has a better impact on health and nutrition than any other form of income investment or poverty reduction strategy. So from our global development point of view, we look at nutrition as part of our agricultural investments. We look at how improving agriculture can be directed toward improving health and nutrition. It just makes perfect sense. In the Global Health Program, we look at nutrition as fundamental for many of the other things we're aiming to achieve. As Dominic said, it's an important underlying cause of many childhood deaths, and for that reason we think it's important. But we've also come to recognize that it's really just one of these fundamental ingredients to human health. And especially now that we're focusing on nutrition from the conception through the first 1,000 days, we can really begin to understand that how important it is to have adequate nutrition from the very early stages of fetal life onward, and how this is an investment that has lifelong impacts. So as you can see in this slide, this is a little baby from Bangladesh. He's in one of our programs called Alive and Thrive. He's actually quite a healthy baby, and he's just had a nice complimentary feeding meal. What we know is that adequate nutrition from conception through the first 2 years of life is essential for adequate organ formation as well as organ growth during the fetal period. We now know that malnutrition in early infancy, not only in early fetal life and during the antenatal period, not only does it increase the risks of low birth weight and immediate death, but it's also been associated with long-term health outcomes, risks for various nutrition-related chronic diseases, particularly not just in the developed world, but in countries that are in transition and in countries where there's changing dietary patterns. So this fetal period, this period of antenatal nutrition, it's setting many of our biological systems that affect how our metabolism works over the course of our lifetime, thereby programming us to different sets of risks in later life. We know that nutrition is important for a strong immune system. Many nutrients, micronutrients, essential fatty acids are essential for how our bodies work. They are essential pieces to an adequate immune function. We at the Gates Foundation invest a lot in vaccines, and we know that some vaccines simply are not working as effectively in malnourished populations. We don't yet know why, but we know that adequate nutrition is important in order to stimulate a strong immune response and in order to fight infection. Malnourished children become malnourished from infection, but that nutritional status, that nutritional risk, actually increases the likelihood that they'll have more severe infections of many, many types and therefore die. So we believe that nutritional interventions are quite important for infectious disease programs as well. And perhaps many of you didn't know this, but before the era of HIV, malnutrition was often referred to as a nutritionally acquired immune disorder. And so many people, many children, they called it NAIDS, even before HIV. We don't talk about that much now. But that's another reason why we think investments in nutrition are critical for global health. Of course, physical health, as I've just said, and as Dominic showed you, physical growth, and nutrition is an essential ingredient it's necessary, adequate nutrition. Diet quality, not just quantity, is what children need in order to grow well and to grow to their genetic potential. And finally, an area that's of increasing interest to us is the very important role that adequate nutrition plays in brain development and in cognitive development. Earlier this week, I was moderating a session at a conference in Washington, D.C. called Experimental Biology. And one of the presenters was reporting on data from a study in Guatemala. And this was a study in Guatemala. It's very famous in the nutrition world. I don't know if any of you have heard about it. It's called the INCAP Nutrition Studies. And these studies were actually done in the 1960s and 1970s, where they had provided early nutritional interventions to communities. And the communities got two different types of interventions. One was a very nutritious food supplement that was given to pregnant women and children, and the other was basically a non-nutritional supplement, but it was sort of at that time like a placebo, if you will. And they've actually followed these children that were exposed to this early nutritional intervention, and they followed them into adulthood. And what's been really remarkable to see is what a long-term impact that early intervention has had on the lives of the children, both the boys and the girls. And what I was really surprised to hear was, particularly for the girls that were exposed to this early intervention in the first few years of life, they scored higher on cognitive and learning tests in adulthood. They had better outcomes in the marriage market. They married well. They married better than the girls who were not exposed to the intervention. They were less likely to be poor as adults and as mothers themselves. They had fewer pregnancies, and they also had lower risks of miscarriage and stillbirth. And what this really said to me is this was an investment that has lifelong returns. And it's really something we've just begun to really truly appreciate, that this early intervention in the first 1,000 days is really truly a window of opportunity. So that's a little bit about why we have chosen to focus in this area and why we think it's so important. So what do we do about it? I think that it's often said that we have the burden of knowledge when it comes to what to do about undernutrition. It's not like some of the other fields that we work in the foundation where we don't have solutions. We actually have quite a number of solutions, and maybe Chris will talk about one, and there's many others. What we've really lacked in this field is a strong commitment and a focus. It's only until recently, and Cindy will talk a little bit about this, where the communities really rallied around this 1,000-day focus. Before, we were focusing on many different things and calling it nutrition, often focusing on food quantity, ensuring that there's adequate calories in someone's belly without focusing on food quality. Now we're really rallying around this evidence on how to have the best impact. We think there's ample opportunities for expansion in this area, ample opportunities for growth, if you will, and really achieving an impact. In the session yesterday on markets, we talked about the need for better advocacy so that people understand and align around this issue, understand it and take action. That's both amongst the global community as well as at the country level and even at the community level, since as Dominic alluded to, this is not always a visible problem. We also need innovations, and we'll hear a little bit about that, but new ways to tackle the problem because the world is changing and we need to find better solutions, find ways to put new technologies and knowledge to work for us so that we can have more effective interventions. And then finally, there's many, many opportunities for unique public-private partnerships across a broad spectrum of potential areas to intervene, from our traditional approaches to doing research and giving grants to loans and to working with entities that are going to do impact investing, because unlike some other fields where you're dealing solely with drugs or vaccines or things like that, the food sector, the nutrition sector is really a very diverse sector. It's local. There's many different ways that you can find ways to have an impact that will create some of the double wins that we're looking for at the foundation. So I'm going to stop with that and turn it back to you. And I didn't talk too much about the science, but I thought that would be a little bit boring at breakfast.
Thanks a lot, Ellen. You spoke of solutions, and I think it's important to really underline that we all are always seeking the easy path, the single solution, the silver bullet. And I think that's what we keep getting reminded of in addressing malnutrition, is that there is no silver bullet and that there is no single solution. And really the challenge is how do we integrate different solutions together in the most cost-effective way. Associated with that also, though, is an understanding that there is also no single player, no single stakeholder who can solve the problem. A lot of different sectors have taken on the mandate to do this, whether it was the ag sector or whether it's the health sector, but really we recognize now that it's very important to pull together the right kinds of partnerships that really draw on the strengths of government, civil society, and the private sector so that we could put to best use the different channels of access that there are for the poor to both services and good quality products. And those channels obviously can channel through the public health system, but through markets as well. And so with that, I'd like to turn to Cindy Huang, who will speak a little bit about a new partnership and one that the U.S. Department of State is behind.
Great, thank you so much, everyone. I want to particularly thank the Gates Foundation, and it's always such a pleasure to work with Ellen. And just hearing you speak reminds me of the kind of the passion and knowledge that the Gates Foundation brings to this issue. Gain, of course, for organizing, Chris for being up here on the panel with us, and all of you for being here, again, on the early side, so we really appreciate it. So the U.S. government has really elevated nutrition in our diplomatic and our development efforts. It's the linchpin that ties together our two flagship development initiatives, the Global Health Initiative and Feed the Future, the Global Hunger and Food Security Initiative. This is in recognition of many of the facts that Ellen and Dom highlighted of how tackling undernutrition is really critical in terms of health and economic development and long-term growth. But what's really exciting about the 1,000 days and what captured Secretary Clinton's imagination is that now we have a clear entry point for action based on data. The science, just to repeat again, the science shows that without good nutrition in the 1,000 days from pregnancy to a child's second birthday, there are irreversible consequences for cognitive and physical development. Clearly, this limits the economic growth of communities and countries. Secretary Clinton, as most of you know, has a long history of being a champion for women and children. And therefore, she decided to launch the 1,000 Days Initiative last September. 1,000 Days is a partnership that aims to galvanize national and global stakeholders, including all of us here, to tackle the crisis of undernutrition. It also calls on the nutrition community to set clear goals and milestones for making significant progress over the next 1,000 days from last September, so that gives us until June 2013 to make some real progress. Secretary Clinton became a champion for 1,000 Days, not only because of the burden of evidence, but also because she recognizes that we finally have the opportunity and the concrete framework to move from crisis response to prevention. 1,000 Days is a compelling entry point for action for all stakeholders, governments, businesses, civil society, and of course, philanthropists. As Ellen mentioned, there are clear, cost-effective investments that we can make in this 1,000-day window of opportunity. And I'll just list a few, but I really look forward to more conversation about other innovative solutions that we can come up with together. There's education and behavior change around good nutrition and breastfeeding, crop diversification and home food production, for example, gardens and livestock, to increase the availability of nutritious foods, access to clean water and treatment of diarrheal diseases, and private sector partnerships to make fortified and nutritious foods more accessible to pregnant women and children. Now, as Dom just mentioned, this doesn't mean that this is a simple problem with a simple solution. Nutrition is caused by a number of factors, and therefore we need to coordinate and program according to context. I was recently in Tanzania, and I was visiting a program where we're trying to provide a higher yield and more nutritious sweet potato. And we weren't working with the poorest of the poor in this area. There were, people had livestock, poultry, and they were also using their cell phones to get access to the best market prices. But even in this community, the children were very undernourished. And so for me, this was a real missed opportunity and really reflects much of the siloing that we've been discussing here at this forum. Ultimately, and I think this is something that we just all know from our hearts and being parts of families and communities, people want to invest in the health and the economic potential of their children. So we really need to empower women and men with the knowledge, tools, and nutritious foods to take action on that 1,000-day window. Investing in women can, in particular, yield high returns because we know that women tend to spend more of the income they control on the health and nutrition of the next generation. And this is one of the reasons why Secretary Clinton has put women, girls, and gender equality at the center of so much of what she does. In so many cases, as she likes to say, investing in women is not only the right thing to do, which it absolutely is, it's also the smart thing to do. 1,000 Days is an opportunity for all of us to invest in a small window of time that has large and long-term impact. And I think this is a really critical point because for a long time, the nutrition community was, talking about 10 micronutrients or 20 micronutrients and really getting into the weeds. And I think in the process, we've sometimes missed the big opportunity to say that there is something we can do that has lifetime consequences and therefore is really one of the world's highest return investments. So I hope it's clear how much I care about this work, and it's really a privilege to work for Secretary Clinton on this issue. So I just wanted to end with a quote from her. "Few issues provide a more direct, affordable, and effective way to save and improve lives than nutrition. But as experts on nutrition will attest, it has long been overlooked by a global community focused on other priorities, because there are so many priorities that capture our hearts, that really speak to us. As governments and organizations, and here I'll add philanthropists, search for strategic interventions in the fight against poverty, places where our money and our effort can make the biggest and most lasting differences, nutrition represents a ripe opportunity. We hope you'll join Secretary Clinton, Gain, and the Gates Foundation in our effort to make an impact in the 1,000 days. Thanks.
Thank you very much, Cindy. You raised a number of key points there, I think, that are, again, worth underlining. Of course, as with Ellen, that whatever decision that we make, if we want to be smart about the investments that we make, it really does need to be evidence-based. Mm-hmm. And I think that really following the science on this is an imperative. The other issue that you raised, though, which is very interesting, is that that this is a smart investment. But in order to make a smart investment, we need to understand how the system works and where those strategic investments can be made. And if I could just go back to this chart again to illustrate, a lot of what happens as the child growth falters, that squiggly Charlie Brown line, happens in an environment where it's normal. Your neighbor looks like this too, and this is happening. And so the educational component, of course, is extremely important. Mm-hmm. But the other element of this is that there is no response except for to offer more advice about the foods that you need to eat. And often what happens is that children will live through that until they become stunted. Or if there's a shock, an economic shock, or one where they get an infection, that's when they become severely acutely malnourished, really 2 weeks to live. And then the system kicks in again. The emergency system that you mentioned, Cindy, kicks in. And the imperative for us to move away from an environment where we're basically mopping the floor without turning off the tap, by moving from crisis response to prevention, is very important. And so with that imperative in mind, I'd like to move to Chris, who will speak a little bit about the systems available to us to address this problem and how we should understand them.
Thank you, Dom. I gave this talk yesterday, so for those in the audience who were here yesterday, my apologies for the duplication. Jane said that, Jane Wells, who I see in the back there, said yesterday that we were going to live stream. Well, right now we're in reruns. And I think I'm doing this because I didn't get it right the last time. In any event, I'm going to try and stick close to the agenda and talk for a few minutes about the development of smartphones, and then about agriculture and nutrition, and then about business-like decisions, or rather the lack of them that currently drives a lot of what we do in the developing world. Now, I have here the latest offering from RIM, the BlackBerry. It's a smartphone, a very smartphone, but roughly 10 years ago, when this forum started, its predecessor was a little more than an email device. Email, as we all know, back then, 10 years ago, was one of the killer apps. Now, just 10 years on, that email killer app is just one of a number of apps and technologies, all working together under the management of a very sophisticated operating system. How did this device evolve in just that 10 years from a single killer app to that integrated communications solution? For a number of reasons, of course, but probably one of the most important was that smart business people and their smarter investors kept asking the right questions and kept seeking and acting on the right answers. For example, question 1, what business are we in? The answer there was, we're not in the email business, at least not for long. We're actually in the much broader wireless communication business. Question 2, what do consumers need to address all of their day-to-day communications-related activities? And the answer there lay in an enormous amount of market research, among other things. Question 3, what are my growth and migration strategies to get there? And the answers included more product innovation, mergers, strategic acquisitions, and partnerships. Essentially, then, we moved from that exceptional killer app, email, to a vastly more exceptional wireless communication solution, a much bigger picture with a much greater impact and profit potential, through a process that involved, quite simply, understanding what we wanted to be when we grew up, understanding how consumers operated and what they wanted, as opposed to what met our technological interests, and pursuing very business-like partnerships. Now, let's turn from this commercially successful marvel to what many consider to be one of the killer apps of the nutrition development world, if I can stretch that term somewhat. I have here a simple packet of sprinkles. It's the micronutrient powder that in its original form, a mother could sprinkle on her young child's food to provide the iron that prevents and cures anemia. Now currently, in its improved and greatly expanded varieties, it provides many of the essential vitamins and minerals for infants and young children, pregnant and lactating mothers, adolescent girls, and so on. Now Sprinkles was invented and developed in the late 1990s, and importantly, it was at the same time frames as this email killer app. It was invented by my old colleague, Dr. Stan Zlotkin, at the Hospital for Sick Children in Toronto. Now, Sprinkles is a massive success by many measures. And think about this. This was invented in a Canadian public hospital. It was done so on a challenge by UNICEF. It was funded by an American foundation, Heinz Foundation in that case, and supported by international organizations like GAIN, the ideal sort of partnership. But in any event, in relative terms of expansion and integration, however, this killer app has moved only at best to the equivalent of just that merger of basic telephone functions and basic email functions that occurred with this thing in 2004. So why the lag? Why the lag in the developing world? There are a number of reasons, all of which are subject of a half-written book, but perhaps most importantly, only a few organizations like GAIN and some investment advisors, undoubtedly like some of you here in this room, are asking the right questions and seeking the right answers. Because we live in silos in the development world without question, and for some reason, the savvy investors who have the power to press for the right answers in business often become just passive donors in the face of a social cause. If you ask the same questions I just raised a few minutes ago of many people in the development world, and to use my micronutrient powder example, this is often the sort of response you get. Question one, what business are you in? Answer, the micronutrient business or the fortified oil business, not the nutrition or agriculture business, and certainly not ultimately perhaps something like a sustainable, healthy food and feeding business. Question two, what does a consumer require to meet all of her day-to-day healthy food and feeding needs and activities? Answer, I don't really know. I told you I'm in the micronutrient or the fortified oil business. Question three, what are our growth and migration strategies? Answer, ask for more money and do more of the same. And by the way, what's a migration strategy? And what that reveals, the difference between those questions and answers, is a fundamental gap we have to bridge to achieve the impact economies we're all seeking, into which Jane's agenda alludes. So how did I come to form these views? For around 25 years, I was an advisor to all kinds of science and technology interests, focusing on the commercialization of innovations in the developed world, North America, Europe, Japan, clients like RIM. About 5 years ago, the Hospital for Sick Children, my client, asked me to work with Dr. Zlotkin to produce a business plan and to organize more formally the Sprinkles Global Health Initiative. Now, here for me was the opportunity to understand the other side of commercialization and the use of science and technology in the developing world. And bonus, to do so with a killer app, which was sitting right at the top of the needs and best return on investment list presented by the Millennium Development Goals and the Copenhagen Consensus. Now, the first order of business, of course, was to accelerate the work of getting Sprinkles globally accepted, sustainably supplied, and continually improved, which meant working with the likes of GAIN and UNICEF to develop sustainable, three-dimensional implementation models which covered all of what I refer to as the science, supply, and social components. But then there was a strategic need to understand where this product fit into the integrated model I touched on before. And to us, that demanded that the product itself needed to be set aside for the moment, and that we turn to the task of better understanding the environment in which it was or should be a part, that sort of healthy food and feeding environment. Now, the best way to do that, I decided, was to follow one of the most widely used commercial foods to the very furthest ends of its distribution points in places like Nepal and Bangladesh. So I chose the instant noodles, which are ubiquitous around the world. And the objective, in addition to studying how last mile commercialization really works, was not to go in as a missionary for any particular product or program, including this one, but just to listen to the priorities and perspectives of the people met all along the way. Now, time doesn't permit me to get into the detail. That's the subject of a long paper that I wrote last year. But two key points are worth emphasizing here. First, there was a constant reminder in these studies that the perspectives and priorities of a family in a rural community do not revolve just around selected aspects of nutrition or agriculture or anything else. The day-to-day struggle of the average villager is about eating well year-round so as to stay healthy and strong enough to earn cash from crops and labor, so as to be able to buy basic goods and services, including food, healthcare, tools, education, and so forth. And if you don't take into account all of those perspectives and all of those priorities, you can't possibly expect to get optimal attention for your particular product or program. Second, if you get out of the trees and view the whole forest, then what you start to see are all kinds of interesting new points of entry for investment, ranging from logistics to knowledge and exchange centers that are attractive to the entire community, not just a targeted few. In any event, in the process of this work, I've had the opportunity to interact with a variety of stakeholders, great people in the public, civil, private sectors, but most are trained or driven by the current systems to think and act in silos. Few of our current investment models, which is the theme here today, and I use that term investment model, by the way, rather than funding model deliberately, motivate or help people to think about joining their vertical interests with an integrated solution. And I take comfort in knowing that this belief that we must integrate our efforts is shared with people who really do get it. Here's what Graca Michel, is one of the first ladies of Africa, had to say last year at the GAIN Regional Forum in Joburg, South Africa. She referenced governments there, but you can easily substitute investors. And she said, and I quote, "The responsibility of each government investor is not to fail our children, not to look at children as if they are fragmented human beings, where government investors will be concerned about education, but they neglect health, or sometimes they'll be concerned about immunization, but they're not concerned about nutrition. We have to look at our children as complete human beings with complete needs. It's not half and half, or even a quarter or so, if there's to be a possibility to be healthy and to be intellectually strong." Thank you.
Thank you very much, Chris. I'd like to give a round of applause for our speakers.